Hello, I'm Pat Mallory. I'd like to talk today about PRP, or platelet-rich plasma. Platelet-rich plasma is something that we make from a patient's blood, and we then inject back into that patient for a variety of different uses. It turns out that platelets in our blood are responsible not only for making blood clots, which many of us have learned in basic biology, but they also release things called growth factors and other compounds which stimulate a variety of different processes to occur in our bodies that result in healing and improvement of tissue in a number of different ways. Some of the things that PRP is used for include sports medicine type injuries like ligament, tendon, and cartilage injuries, and those could include such examples as rotator cuff injuries, tennis elbow, golfer's elbow, even sacroiliac joint problems. It could also include arthritis issues, such as arthritis in the hand, like in the knuckles. Might also include arthritis in weight-bearing joints, as long as it's mild arthritis. There are also applications for PRP in cosmetic purposes. So in our med spa looks, we use PRP to address skin tone issues and collagen deficiencies, because the same growth factors that are released by the platelets that stimulate healing of ligaments and tendons also stimulate reformation and improvement in collagen and skin surface characteristics. The protocol for moving forward with a PRP treatment, whether it's clinical or cosmetic, is to schedule an appointment with a provider here at my office. At that appointment, we will discuss whatever the concern is that you might have. We will evaluate your overall medical health. We will determine whether your issue is a good candidate to be treated with platelet-rich plasma. And we will also discuss with you whether we think there are other options that you should consider. Once that's been done, assuming we're going to move forward with a platelet-rich plasma treatment, then we'll schedule you for a visit to come in and have your PRP treatment. At that visit, you will arrive about a half hour to an hour before you see the provider. One of our technicians will draw your blood and prepare platelet-rich plasma from it. And then when you see the provider, you'll have injections appropriate to whatever the condition is that we're addressing in your case. There are a couple of differences in our approach to preparing PRP that are worth mentioning. One is we use a method of preparing PRP that doesn't involve some expensive equipment that other clinics might use. A side benefit of that process is that when we evaluate the potency of each and every PRP sample that we make, if it doesn't meet our potency requirements, we're actually able to reprocess that specimen so that it does actually meet our potency requirements. As a result, besides having lower prices, our product is very potent and we see excellent results. I've actually been doing regenerative injection therapies for about 18 years at this point. I started doing something called prolotherapy in 2001, and then I began doing platelet-rich plasma treatments in 2007, so for 10 years. And I started doing stem cell treatments in 2012, so now 5 years. Besides having lots of experience and going through lots of trainings and treating lots of patients with these treatments, I've also completed a fellowship in stem cell and platelet-rich plasma treatments. That stem cell was sponsored by the University of South Florida. For more information about platelet-rich plasma, feel free to click on the links to our Facebook and website, or by all means, call the practice and schedule an appointment. I do also have a link to this card that I prepared for my patients, which you can click on at our website and on our Facebook page. It has a number of questions that you can ask of any provider who you might be seeing who's offering platelet-rich plasma and or stem cell therapy. These are questions that will help you to evaluate the provider as well as the PRP